This month takes special meaning because of the unprecedented and extraordinary challenges that our community has faced this past year. I'm so proud to stand along with all of my colleagues who have been addressing this issue from multiple fronts through emergency appropriations to help support our organizations and Department of Health and Human Services who are on the front lines, through constituent services and calls that each of us have received from families and community members in crisis. And we have also been working diligently to address any policy barriers and to help ensure that funding goes to these organizations the most in need. The trauma and increased stress and anxiety and isolation and loneliness, the grief and loss that so many have experienced this last year truly is unprecedented. We've seen significant increases in calls to our help crisis line. And we are just now beginning to process and come into focus the challenges that all of our children and youth are going to face when they come back to schools. Our parents obviously have been under tremendous stress, and our most vulnerable communities have been even more impacted than usual. Joining us today are a group of really extraordinary and outstanding leaders, both from our county's Department of Health and Human Services, as well as members of the community and community leaders in this very important space. In a moment, we will hear from Dr. Kroll, but we also have with us this morning Dr. Rolando Santiago, who is the Division Chief for Behavioral Health and Crisis Services, as well as all the members of his leadership team, including Ms. Regina Morales, Dornay Hill, and Hardy Bennett. They have just been doing extraordinary work 7 days a week to establish so many important programs and services. We also are joined this morning by Luis Cardona, who leads our street outreach network and has done yeoman's work in engaging our youth during this difficult time. We also have from Linkages to Learning, Ms. Monica Martin, who leads the HHS Child and Adolescent and School and Community-Based Services, and Ms. Kirsten Anderson, also with Linkages. And from our incredible community-based organizations, we have Ann Mazur, the CEO of Every Mind. We also have in the audience Ms. Karishma Sheth, the Chief Program Officer. And we also are joined by Cornerstone Montgomery and Carrie Cho, the CEO. Both of those organizations have done really extraordinary work. And we also have from the Mary Center, Ms. Leah Chauval, the Care Coordinator Director, and Ms. Andrea Zawatowski, the Behavioral Health Director. Their innovation around telehealth and telemedicine within the Mary Center has truly been a lifeline for so many. We're also joined, it looks like this morning, by all of my colleagues who I know have been extraordinarily engaged and very much focused on all of these issues. I want to thank all of them for their extraordinary leadership. And those that are here on now, I'm going to ask each of them to make some brief comments. We want to stay on schedule this morning because we have a huge public health order that we want to cover. But I know everybody is very focused on these issues and want to make sure that everyone has the opportunity to say a few words. So with that, I'll start with folks as I see them on my screen. And so I'll start with you, Councilmember Friedson. And then after my colleagues speak briefly, we will hear from Dr. Raymond Kroll, and then Councilmember Rice and I will read the proclamation. But Councilmember Friedson.
Thank you so much, Council Vice President Albornoz, for all of your leadership as chair of the Health and Human Services Committee, and for all of our partners in the executive branch and Health and Human Services, and most importantly, our partners in the community who are delivering services to residents. It's been an incredibly challenging year, and mental health is one of the major crises of this crisis. And I'm really proud of the work that this council has done, that our partners in the executive branch have done to try to step up to meet the needs of the crisis. We were working on mental health and expanding services prior to it, and we've stepped up to try to build from that, but we know there's a lot more work to do. I've been saying a lot to remember the airplane training for safety, that you're supposed to put your oxygen on first before you take care of your loved ones. And that's true in mental health too. We have to make sure we take care of our own mental health before we focus on taking care of others. And so I just a friendly reminder to all of our residents going through a challenging time to take care of yourself and to make sure that we're taking care of each other by taking care of ourselves. And thank you so much to all of our partners for all of the incredible work that you do, and particularly the volunteers who have stepped up in this time of need in our community. So thank you very much.
Thank you. Councilmember Rice.
Well, thank you very much, Mr. Chair. And I want to thank all of the advocates who've continued. You know, it's very interesting as I look back on the history of how Montgomery County has handled mental health and made it a priority. And I remember the foundation of Cornerstone and how Cornerstone came to be. And remember the two leading institutions that came together to form that. And the conversation around it was that we need to continue to unite ourselves together to really focus on what we see as that bigger picture, which is serving as many residents as possible and understanding that we needed to prepare for the continued challenges that we will see in the coming years. And lo and behold, we find ourselves, as you heard from Mr. Chair, aptly prepared for the future because we planned well ahead of time. When I think about Every Mind, and I think about Ann and the leadership there, when I think about Mary's Center, when I think about all of the folks within HHS who continue each and every day to make sure that those are prioritized, and our great leader of Health and Human Services now, who has his behavioral health background, it is one where we are aptly positioned to be able to take on this pandemic head on. And so I really just want to thank each and every one of you, because truly you have saved lives. I've been throwing that phrase around for a couple days now, and it is true. There are many people who we know couldn't handle the challenges with the pandemic and reached out to your entities for help, and you talk them off of that ledge. You won't read about it in the paper, you won't see it on the news, but you know that it happened. And so each and every one of you and your organizations and your volunteers and your staff did yeoman's work in terms of helping us to get through the pandemic, because not only did we lose people to COVID, we also lost people to mental illness as well. And that's something that we need to always remember and keep prioritized so that we can ensure that we're lifting up those who might need a helping hand. So again, thank you very much for everything that you do. And I turn it back over to you, Mr. Chair.
Thank you. And just in order, we're going to go Councilmember Javando, then Councilmember Navarro, then Councilmember Katz, then Councilmember Reamer. And remember, we're got Councilmember Javando.
I got my, I know, I heard where I am. I got it. Good morning, everybody. And thank you and to all of my colleagues and to all of the folks that are here. You know, this has been a tough year and mental health issues were an issue before. But as we've said, as we've dealt with this pandemic, it has impacted every single resident of our county, of our state, of our nation in some way, whether you've lost a loved one, like I have and so many others on this, even on this Zoom have, and you know somebody who's been impacted, you've had COVID yourself, you've lost a job, your kids have struggled with the online Zoom format, go down the list. Stress, anxiety, it's why 4 in 10 Americans report having some form of depression or anxiety over the last year. It's a dramatic increase, and millions of folks are living with this. And we already had a stigma on mental health. And to a point that was made earlier, we know that we're dealing with so much, and you want to help your family, you want to help your kids. I'll just speak for myself. I have neglected my mental health trying to help the community and help my children cope. And I'll just be honest about that. And it has come to a culmination point for all of us. And it's really important to stop in May because this is the theme of the month, and step back and be kind to our own minds. And as Councilman Friedson said, put our own mask on because it's going to have lasting effects physically, emotionally on all of us. And so I just want to thank you, all the groups that are assembled here, for all you do, and our HHS staff and their team and Dr. Kroll's team, for all you do to help our residents, because it's going to be needed now more than ever as we all work to recover out of what has been something no one alive has experienced, unless you're over 101 years old. And so we're going to need a rapid step up in what we do. And I know we are prepared. The foundation has been laid, as Councilmember Rice said, and I'm just proud to be part of a county where we take this seriously. And thank you to Vice President Albornoz and Chair Albornoz for his stewardship of the HHS committee. We're here for you. We're going to be here for the needs for our students, for our seniors, and everyone in between. And we have the great team to do it. So thank you, and thank you for all you do.
Thank you. Councilmember Navarro.
Thank you, Mr. Vice President, and thank you for highlighting this very important issue. There's always a silver lining, I think, and I hope that this experience has, finally has put forth mental health as an absolute priority. It is often said that when we talk about going to the doctor and taking care of our physical health, it is much more apparent because you can point to it, you can see it. With mental health, of course, it is a very difficult, in my opinion, issue to address because folks don't quite see it, except that it is so tied to our survival. And it is so critical, I think, also to reflect on the fact that 2020 really was the culmination of a sustained period of stress in terms of the national political divisive rhetoric, the renewed reckoning with, institutionalized racism. And then you had the pandemic, which came to really show everyone that our life is so very fragile. It continues to be a concern because it's an invisible virus. Now, let's just think about compounding all of those issues and the fact that it has been sustained for a long period of time. We are not equipped as human beings to have to deal with such a sustained level of stress and threat. And I think this is why it's so important that this team that is assembled here, that you are applauded and that you are supported, and that you also need to be heard. As elected officials, as policymakers, we need to hear from you what are the best practices in this space, especially for our county that is so diverse. The issue of cultural proficiency, the issue of linguistic capacity, is front and center because we know the one size does not fit all. We might think that what we are funding and putting forward is the best possible approach, but I gotta tell you, right, because we all know this from personal experience, that unless you see yourself reflected in the kind of care, the kind of opportunities that you're participating in, it is not going to help you. As a matter of fact, I think sometimes it exacerbates the issue. And so that is why having these kinds of practices and service delivery models that really address all of these complex issues in a culturally proficient way, in an accessible way, it's so important. So I am just very grateful to each and every one of you for everything that you are doing. And I will associate myself with my colleagues' comments about the fact that all of us are committed to making sure that you receive the resources, the support, and also the flexibility to be heard in terms of what it is that our residents need. Thank you so much.
Thank you. Councilmember Katz.
Thank you very much, Mr. Vice President, and thank you and the HHS committee for all that you're doing as well. We have heard time and time again that it takes a village to raise a child, but the real reality is that it takes a village to help a county, and that's exactly what is being done. For years, we decided it was something that society felt that if we didn't discuss mental health, that it wasn't a problem, that there were people that were embarrassed to talk about the mental health issues that they and their families were having. Thank goodness that is not the case today. Today, people are working together and coming together to help each other, to help their neighbors, to help their family members come through these trying and difficult situations. And the way we can do that is by discussing it, by having people, professionals, actually work with other people. I was on the Cornerstone Montgomery board, proudly that I was on the Cornerstone Montgomery board, and I heard firsthand of the good, hard work that our nonprofits are doing. In many cases, they do it with You wonder how how they are affording to do it. And we have to make certain that they receive the resources and the funding that is so very necessary. But I just want to publicly thank Dr. Kroll and Dr. Santiago and everyone else who's actually in the fields, Carrie Cho and everyone else who's actually in the fields doing the work, because it is so very necessary. And I want to end by saying that we are most appreciative, and I know that the people actually in the fields doing the work never get enough thanks, but it is so very necessary for us to say to them, thank you for doing the good work and helping everyone else. Thank you, Mr. Vice President.
Thank you. Councilmember Reamer.
Thank you very much. It's so wonderful to see our partners on screen, and my colleagues have been so eloquent. I just want to add that we need to normalize the idea that mental health impacts are a consequence of the pandemic, and that it is okay if that's how you're experiencing the pandemic, and it's going to take some time to recover. And we need to do, I think, a really full job understanding those impacts in the community. I have a very strong concern that our teenagers are experiencing it in ways that we just don't know yet, frankly, because we haven't had adults around them, other than their parents to kind of help understand it. So we've got a lot to learn about what the pandemic the consequences are, and we've got to put in place a multi-year recovery strategy. And our partners here on this call you're the front lines, you're the antennas to share back with us how you think it's going and what we need to be doing. And we're just grateful for your partnership. And as was said earlier, and we've said so many times, having these partnerships in place means that when you really need them, you're able to draw on them with so much greater impact. So thank you, proud to support you, and we'll keep doing this together. Thank you.
So we're going to need a full council session on this soon because I know everybody's extraordinarily engaged. And I also want to acknowledge Councilmember Glass, who's our lead on homeless and vulnerable populations, for his leadership as well, just rounding out the entire council team. We're also joined this morning by Ms. Dornay Hill. Dornay, thank you for your leadership. I've just so enjoyed working with you this last year in particular. And the setting up of the mobile crisis units has been extraordinary. And I know a lot of that heavy lifting has come from you. So thank you for that leadership. We'll now hear from Dr. Kroll, and then Councilmember Rice and I will read the proclamation.
So good morning to you all. Thank you, Council Vice President Albornoz and the members of the council. It is very fitting and very deeply appreciated that you all have taken this moment to acknowledge that more than ever, our mental health matters in this county. In a typical year, 19% of adults will have an anxiety disorder. 39% of adolescents may have an anxiety disorder. 17.3 million adults in the United States will have had at least one major depressive episode, and 35% of those typically won't get any treatment for that. In 2018, and this is the last year we have data for this, suicide was the 10th leading cause of death overall in the United States and claimed 48,000 people. That's more than 2.5 times as many suicides as there were homicides that year. It is a significant challenge and remains a significant challenge. And we know that the numbers have been rising in recent years. All of that was before the pandemic began. That was before we ever had this virus that descended on us and threw our lives into chaos. Since the beginning of this pandemic, we've had 41% of the adults that were asked and interviewed in January reported some symptoms of anxiety and or depression. So those numbers have jumped, almost doubled. 13% of adults reported an increase in substance abuse due to coronavirus-related stress, and 11% of adults reported thoughts of suicide in the past 30 days. We know that our adolescents are equally struggling and stressed by this and the fact that they've lost a lot of ground this year. A little closer to home, since the beginning of the pandemic, 15,000 people have visited our local emergency departments due to a mental health emergency. 9,000 or more have been transported to an emergency department because of drugs. And last month, we learned that in 2020, Montgomery County had a total of 108 overdose fatalities due to opioids. That's a 25% increase from where we were the year before. As people are isolated and shut down and cut off from their normal mechanisms of support and recovery and treatment, their risks go up, and we know that. So I won't belabor that anymore, but I wanted to set a context for what's been happening in the county and what you all are talking about today. You know, we are fortunate to have people and services who are dedicated to protecting and restoring our mental health in this county. Throughout this pandemic, the mental health services in Montgomery County have continued through telemental health, home and community-based services. Our peer recovery specialists in programs like STEER and Tree of Hope went online and created networks of providers to make sure that people who needed recovery could get access to residential and addictions treatment. Our local behavioral health authority expanded its effort on suicide prevention, bringing together behavioral health and somatic providers, consumers and community members, the school system and local hospitals to try to develop and improve suicide prevention approaches across the lifespan from birth to old age. Our crisis center has seen an increase in the number of folks that are and the number of folks that are calling in and coming in. The mobile crisis team increased its mobile crisis response by 37% this past year, just from July to December compared to last year. And with the support from council and under the direction of the county executive, we're expanding our mobile crisis capacity to meet the needs that we know are coming now. Mental health and drug courts and trauma services shifted to virtual work. And for the first time, we were able to secure virtual attendance at court proceedings for peace and protective orders in the county to protect our victims of domestic violence. And I have to say, and give a special nod to the volunteers who donated over almost 5,000 hours of service to victims of sexual assault and domestic violence by going to the hospitals and following them into courts to help being with them in courts to keep them supported during this time. Linkages to Learning is a program that everybody knows the name of. And the therapists in Linkages to Learning shifted to telehealth in order to stay connected and change their focus to manage the increased mental health needs, as well as the grief and loss and emotional effects of isolation and financial stress that families and our children were experiencing at home. They've stayed accessible, and their accessibility has saved lives during this time, especially as suicidal ideation began to rise across the county. The staff of Linkages to Learning taught children and caregivers how to navigate new technology to make sure that when the schools opened up virtually, the students were ready and able to participate, and the parents knew how to use that technology as well. Our systems have worked to maintain housing and food security and to help to connect people to the continuum of supports across this county that would not have otherwise been accessed. Therapy isn't the only thing that is therapeutic in this process. And I will not be able to mention all of the different parts of this and all the different people that played a role in promoting the mental health and securing the mental health of our community. Every mind on the call today: Cornerstone, our Collaboration Council, Family Services, JESSA, Mary Center, Fire and Rescue and MPD, and a lot of others that I don't have time to name today, but whose work has made a difference in the lives of Montgomery County. As we come out of this pandemic, and we are coming out of it, the effects are going to be with us for a while, but we know some things. COVID has challenged our mental health and well-being. It has hurt a lot of us. We've lost family and friends, and no one has been safe. Race or ethnicity, age, or economic status has not protected us, but it has not beaten us. This county has proved to be more resilient than we know, more resilient than we even suspected. And its residents and its service delivery and its providers, they have been there. We have an incredible group of volunteers and peers and mental health professionals is the other thing we know. And they have remained dedicated to promoting mental health to those who need our help. There is help available. People need to know that and know that we are here and the system is strong for them. And thanks to the county and the county executive for recognizing that mental health is vital and for taking actions to help rebuild and strengthen the county's ability to provide that mental health service across the system. This has been a year of recognition, and the need for mental health has been vital. And the last thing we know is that we have each other in a community and in a county that cares for its residents. And that is probably our greatest asset and our greatest source of resiliency. So on behalf of HHS, the partners and providers on the screen today and not on the screen today, and the community, I want to thank you to County Executive Elrich, to County Vice President Albornoz, and the County Council members for taking this time to recognize the work that they do. So I'll thank you and turn it back to you, Council Vice President Albornoz.
Thank you. Very, very well said, Dr. Kroll. All right, Councilmember Rice. Proclamation of the Montgomery County Council. Whereas May 2021 is recognized as National Mental Health Awareness Month, and in looking back to last March when the COVID-19 pandemic struck, we knew it would be a challenging time. However, we had no idea of the unprecedented demands that would be placed on our public health systems and the overwhelming mental health needs created by the crisis. And
whereas even before the pandemic, the prevalence of mental health conditions was on the rise. In 2019, nearly 52 million adults experienced some form of mental illness. Recent data from the Centers for Disease Control indicates that 1 in 4 adults reported experiencing symptoms of an anxiety or depressive disorder in February, which is a significant increase from the prior year. And whereas
youth mental health is also worsening, with nearly 10% of America's youth reporting severe depression. Too many people of all ages with mental health needs believe they have nowhere to turn. Suicide is the 10th leading cause of death in the nation and the 2nd leading cause of death for our young people. And whereas
there is clear evidence that unfortunately the most vulnerable are feeling the mental health effects of the pandemic and are experiencing isolation, sickness, grief, food instability, job loss, and loss of routines. And
whereas in Montgomery County, we are aligned in our efforts to embrace telehealth, new emergency response systems, engage a diverse mental health care workforce, assure evidence-based standards of treatment and care, collaborate with our school system to meet the mental health needs of our students, achieve parity in payment for mental health and substance use coverage, and provide additional support by expanding access to peer support and community-based programs. Now, therefore, it be resolved that the County Council of Montgomery County, Maryland hereby recognizes May 2021 as National Mental Health Awareness Month, and be it further resolved that the County Council calls upon our residents, government agencies, public and private institutions, schools, and businesses to ensure the well-being of our families and communities, now more than ever, to reduce the stigma that often prevents individuals from seeking help. Presented on this 18th day of May in the year 2021 and signed by myself and Council President Hucker. Thank you all for your leadership. And with that, I turn it back to you, Mr. Council President.
Thank you, Council Vice President, and thanks to all of you, of course, not just for highlighting the importance of mental health, but for all of your continued good work for our residents. Thank you so much.